Hey there, everybody. My name is Dr. Dinopappas. I'm a sports and rehab chiropractor in Austin, Texas. I'd like to say welcome to the channel. This video is on utilization of artificial intelligence by doctors in their practices. I did part one. Part one was patients that come to a medical practice, chiropractic office, or other healthcare practice, and how patients are utilizing artificial intelligence. Well, I want to flip it, and I want to provide information to patients now with this video on how doctors, chiropractors, physical therapists, and healthcare providers are utilizing artificial intelligence to process patients, to coordinate care, and to consolidate healthcare information. So I would say the number one current utilization of artificial intelligence is in the administration of healthcare currently. That means anything from note-taking to documentation, to billing, to providing back-end support to make the administration of healthcare much easier and easier and easier. So most healthcare practices are moving into or have moved into utilization of artificial intelligence for all the back-end stuff that requires labor-intensive, time-intensive processes. So the utilization of AI is to try to streamline these things to be more effective and cost less headache and heartache towards patient care. Utilization number two of artificial intelligence is taking these complex data sets, your healthcare results, your laboratory findings, your MRI findings, your X-ray findings, specifically if there's conflicting information in all your history, exam, and testing, to get a diagnosis and differential diagnosis, so therefore we can render the right treatment. So number two, again, consolidation of your testing results to make the execution of healthcare better and more effective, to rule out things, to rule in things, and to get the appropriate testing and treatment and management strategies. Utilization number three, we utilize this for our own research purposes. And what do I mean? Well, many healthcare providers, including myself, we spend time actively trying to get better. We spend time doing searches through medical journals, searches through things like PubMed, which is run by the National Institutes of Health. We are utilizing things like tools specifically that are artificial intelligence to get information, research articles on a very specific source or specific criteria, so we can read up, get better, and streamline our own individual knowledge in our field of expertise or in other areas that could make us better and better and better. So those are the three major utilizations that we see, and in particular that I utilize it for: note-taking, documentation, and coordination of care, to get the right diagnoses and differential diagnoses. And when I'm looking at providing research and spending time in research to make me better in my line of work, which is conservative neuromusculoskeletal care conditions that I see in the office. Those are injuries and treatments to muscles, tendons, ligaments, joints, fascia, and bone. Last thing, as a patient, what you should know is how your provider, and you can even ask how your provider utilizes these tools. It is your right to ask this question and have information. Is your provider utilizing it for the sole purpose of note-taking? Are they utilizing this as a chat bot to funnel the information? Are they using it exclusively for the whole entire visit, including diagnosis and rendering the appropriate treatment? You have the right to ask this question, and you should be able to receive this information. And there should be some form of informed consent that occurs around the utilization of AI, because it is your protected health information and, more importantly, your own healthcare experience. I'm Dr. Dinopappas. Thanks for watching. If you like the material, please subscribe and share.